Our next very special guest is a former Member of Parliament and Minister of Health in the Republic of Botswana. She's also former Professor of Nursing at the University of Botswana and Director of the WHO Collaborating Centre for Nursing and Midwifery. She has been heavily involved in the AIDS response from the time the epidemic started in Botswana in 1985, working to increase community awareness of HIV and AIDS using youth groups, non-governmental and grassroots women's organisations. I sat next to her during dinner last night, and what a thrill you are to be with, Sheila. What a woman. You know what I found out about Sheila? Now, I'm not a very voracious reader of novels. I read lots of, business books and psychology books, but I found out that Sheila is actually the inspiration for a character in an Alexander McCall Smith book series. Did you know this? This is amazing. So it's called The Number One Ladies Detective Agency. It's all about Sheila. It's all about Sheila. She was the inspiration. Can you believe it? Oh, my God. And it was made into a TV series. And you should have been in that TV series, obviously, Sheila. But I did actually find out that you wanted to be an actor when you were a young lady, and it fell into this career, really, because she was an outstanding student, and her college basically said to her, you can't be doing acting, you've got to go into some kind of medical field. They handed her 4 pamphlets of different colleges, different unis around Africa. Is this right? Am I getting this right? Yeah. And I'd had a couple last night. So, they gave her 4 pamphlets, and she looked at one from an Ethiopian college, and she looked at the boys on it and went, oh, they're a bit hot. And so she decided to go there, and that's how she got into nursing. But actually, we're very, very lucky to have her here today because she attended the World AIDS Conference in Melbourne last year and actually had tickets on the ill-fated MH370, the plane that mysteriously disappeared. And for some reason, her instinct told her that that wasn't the flight for her. In fact, she didn't feel that she had the right clothes to come to Australia in, and so changed flights at the last minute. And I think even your friends and family didn't know that you changed, so they were thrilled to know that you were okay, and so are we. Ladies and gentlemen, would you please welcome to the stage Dr. Sheila Tlou.
Boy, you're a good listener. Yeah, she's good. Well, give her a hand. I really enjoyed doing it. Well, let me start by saying, Karen, the members of the APNA, APNA board, it's really a pleasure to be here. I've been to Australia. My children went to school in Melbourne and in Geelong, at Deakin University. So I used to come here, but I think this is like, I wouldn't give, it's really great to be at this meeting and getting inspired. So this is the best trip I've had from, coming to Melbourne. Even the International AIDS Conference doesn't mean, anything, except, of course, I had survived. So that part was good. Yeah. But the other part was simply that we had also lost our colleagues, so it wasn't really that good. Yeah. But I want to say, thank you then to you. But special thanks and recognition to Murphy and Alice. They are good. They are a treasure. And I really, when I got the letter from Murphy and all the things that she was saying, I thought, well, she's an older person like me. Not 60 like me, but maybe, around 40-something. I come here and it's like, you are Murphy? And I thought, boy, she's great. One day when I'm president, I'll get you and you can be my cabinet. That's for sure. That's for sure. And the great part was that yesterday, she looked so much like Cleopatra, the queen of Egypt. I thought, this child should have been an African. She's just in the wrong continent, that's all. So anyway, that's great. But, give him a hand too. He's just very insightful. And in a way, I'm glad you presented before me because you come in with all the things that I'm hoping that as I'm talking, people will really be able to then reflect on some of the, the feelings, the concepts that you brought about. Because mine is really sharing with you a little bit of my life story, but really also sharing with you what's happening globally. Because, sometimes when you are in Australia, down under, we call it there, it may simply be that you are so cut off from the rest of the world, you don't know what's happening out there. And, I'm talking about the AIDS response. And in Australia, there are less than 100,000 cases. So I come in here, I don't even see a sign of HIV anywhere. I look at your TV, nobody talks about HIV. It's like, wow, they are so lucky. But we want you to stay lucky. That's why I'm sharing you this story, because, among young people, the epidemic is coming up in all countries because of complacency. So mine is really sharing with you a story of where we are, my journey, but also the vision of 0 new infections, 0 discrimination, and 0 AIDS-related deaths. A journey that I've embarked on since 1985. But at that time, it was more like, oh, this is a disease. You get it through what? Sex? Wow, I'm in. And I figured, well, I'm interested in women, gender issues. Now, women are not going to age because of this disease. So I decided, okay, I'll go off aging a little bit, aging and menopause, and focus on this one. It will take me 10 years. Then women will be able to age, and then I can come back and do aging. Never did. I aged myself instead, So really, but that's where we are. At least now we are seeing the light at the end of the tunnel, and it's definitely not an oncoming train. So that's the good part. Okay, I'll keep on taking some water, because when I came, a little cold was welcoming me to Australia. And the last thing, when you are an African, you don't want to cough in a plane. Especially because your forms say, if you have been to Africa, go into another channel. So it's like Africa is all painted with Ebola, right? So you go. So I spend the rest of the time from, Sydney to here going, it's your cold. I don't know. So fortunately, when I came in, maybe my temperature looked as normal as other people's. Thank you. But it was good to be here. It's really good. So, but really, my main goal is really to share my own experiences. But really, the expected outcome is simply that I'm hoping young nurses, and I'm seeing very few of them, so I'm hoping APNA encourage young nurses to be here. Otherwise, all this wisdom that we have will not really go on. I mean, at our ages, we are doing generativity, right? We need to be getting new generations. So, next time when I come to this conference, in a few years' time, I'm sure I'll come back. I need to see more young people. Half of them should be young people. Because I really would like people to become, leaders in their own little niche. It's great to be a generalist, but even in the generalist area, you are able to have something which is your passion, as he said. And to follow that passion and really make sure that in the global village that we live in, we are able to interact with other nurses elsewhere and feel like we are part and parcel of this wonderful earth. So it's really that. But let's look at the context in which nursing finds itself. Poverty, degradation, natural disasters. Think of what's happened in Nepal. And the great part is that nurses are usually there. Because of our disaster preparedness, nurses are usually the first to be able to arrive in a scene like that. And we have man-made disasters. And these are literally man-made. As in man, brain, made. You hardly ever find women in a lot of these. I mean, think of South Africa. If you look at any of the things that we had, xenophobia, guess who was instigating that? Men. No woman thinks of xenophobia because sometimes your own sister is married to a foreigner, or you yourself are in love or somewhere wishing you could marry a foreigner. So it's really, but it's usually the men. So anyway, but really, we do have the epidemics, Ebola, and all that. But so we have that protection of human rights of women and girls throughout the world. Gender-based violence is growing in a lot of our countries. I don't know what's happening. We used to have a world where women's rights were respected, but these days, and gender-based violence cuts across. Whether you are poor, or you are a princess, or you are a whatever, you are likely to be a victim. And so you find that we need to do even more on human rights and gender equality. But I got interested in all that, but really from a human rights and gender perspective. What made me do that? What influenced me? I had great role models who are still alive. One is 90, the other is 88. My parents. As far as they're concerned, I'm still a little girl. The other day I was telling them, what are you doing for my 60th birthday? And my father looks at me like, I don't have a 60-year-old. Are you 60? I said, I'm 60. So it was like, really? Maybe you got your certificate wrong. I said, no, I have been alive for 60 years. That part I know. So anyway, but my father was really the main person who used to say, define yourself in everything that you do. Make sure you're out there. I was born after quite a lot of boys in our clan. I was the first girl to be born. So, growing up with boys, you tend to find your space. And boy, I did find my space. But I had a father as a result who used to say to me, you should have been a boy. Everything I did. If I got a prize at school, I come and you look at that, and hug me and say, you should have been a boy. I said, okay, Dad, I'm sorry I disappointed you. I'm a girl. This is what we have. But then one day he had to put me down and said, why I'm saying that? I think you have a great potential. You could really be a great human being. But the point is, you live in a society that is still so patriarchal that a lot of blocks will be placed before you. And, you would not be able to realize your full potential. Of course, I didn't know what he meant when I was little. But then later, as I was growing and seeing some of the glass ceilings that were placed, that I had to break, of course, it was interesting that, I understood what he was meaning. But it's interesting that even just a few months ago, I got the Princess Nakarin Award in Thailand. And he was saying, the Thais know you? I said, yeah, Dad. They read about me and they thought I should get this award. It's a Lifetime Achievement Award. And even then she was like, you should have been a boy. And I'm saying, why? She said, look at you. Even the Thais know you. So now, when I told him Australia, he's like, even Australians know you. So far, I said, yeah, these days we read that. Okay, you really, if you are a man, you'd be United Nations Secretary General by now. So anyway, but really, I got to be there for competitive. And really, in my own, young person image, I didn't even know I was doing such things, but when I saw something wrong being done, I would be the first one to say it's wrong and really put myself out there. For example, child marriage. I was in class with a girl, it's grade 8, who was actually, I used to be either number 1 or 2, and we had, she and I were competing. And then suddenly, I hear that she's engaged to be married. So it was like, are you engaged? To whom? She didn't know. And it was like, hell no. I went to her parents and told her. We were like, grade 8 you'd be what, 14? Yeah. I went over there and told them, why are you doing that? This is a very clever person. Why are you taking her off? So after that, it was like, oh, okay. Well, I had a little bit of influence in that community. My mother was a princess who could actually have been a chief, but wouldn't be made a chief because she was female. So instead, her cousin was made a chief, who was not as clever as she was. So every Friday, my mother would be taken to go and talk, to go and try cases and all that. And she was like, So at least that respect that they had for me, like, okay, she's a little princess, maybe she's talking right. So they let this girl go on until, Form 5, end of high school. But by that time, she had changed her mind, which was great. So she never got married to that person. And that's all we wanted, But I really had a great interest in gender issues, as, all the way. And of course, in acting too, I wanted to do acting. But then I went into nursing simply because I wanted to go to the States. After I saw the brochure on then the beautiful young men. And I decided I'm going to Ethiopia. Then they called me again, our Ministry of Education, say, would you like to go to America? Yeah. And it was like, what for nursing? I said, yeah. But when I got there, I said to them, show me the nearest place, the Department of Fine and Performing Arts. I registered there first before I went to nursing, and have always made sure that I combine my career with acting. It's always been like that until now, when I don't have the time as a regional director. It's quite a lot. But, but really, as an academic scholar, and my interest, therefore, in HIV, once it became a problem, I made sure that I documented. The power of knowledge, evidence through research, was really to document and make sure that people are aware of the impact of HIV on women. At that time, like when we went to Beijing, I participated as a government delegate for the Beijing and the ICPD conference. This is Population and Development in Cairo. And a lot of women, even when we were talking sexual and reproductive health, the African women, especially south of this, sub-Saharan Africa, who were now being impacted by HIV, when we wanted to say, can we add this? And, the influential ones from America were telling us, well, no, that's really a problem for men who have sex, gay people. And we said, no, in Africa, we are not killed by men who have sex with men. We are killed by, it's a heterosexual thing. But as a result of that, the Beijing platform for action does not include HIV. And this year, it was being reviewed at the Commission on the Status of Women in New York. And guess what happened? They were reviewing only the goals, and nothing was mentioned about HIV. We had to literally stand up and say, no, in between those 20 years, HIV came in, and it is still a problem you have to put in. So we are going to have HIV included in the post-2015 development arena. But it really came from that community activism, because in 1988 we founded the Society for Women and AIDS in Africa. Well, throughout, I founded quite a lot of organizations, mainly because I knew of my own limited ability to be able to influence. First, you are a woman, and maybe you don't even have the power of persuasion. I can't suffer fools very easily. So if I'm explaining it to you and you don't get it, sometimes I lose my patience. So I knew I needed people who could then have that kind of skill. So even now I'll be able to share with you. But it was really then the documentation, and as a result, it became, for me, that documentation and working with civil society became a great source of support for me as a minister. How did I become a minister? Well, this was when I was still at the university, head of the Collaborating Center. The only thing I want to point out here is that I made sure that, because I was really aware of HIV, in my research, I involved a lot of nurses. The WHO Collaborating Center was for nursing development in primary healthcare for Anglophone Africa. So we made sure that the nurses came and we gave them skills on really documenting the AIDS response and really make sure that they do something in their communities. Remember, at that time, the only thing you did for women, whether it was women or men, was really AIDS prevention through peer education, making sure that they know how to take care of people living with HIV, and for women, making sure that they have living wills. There was no ARV. So that was it. You're literally making sure that people are facing that impending death. So, but we are able to then really make sure that people do document that we do have a problem, and what then are we going to do about it. And it was really then the power, I was able to instill in nurses that power of evidence, that sometimes, it's not an opinion. Evidence hits you in the face, and you cannot shy away from it, even when you are a head of state. We said when you document, you are able to really show, and that should be able to influence policy, some way or another. So, as an activist, because of that evidence, I used to really, talk about the government a lot. Oh, this government is not doing this. It should be doing this. Right now we are doing this. This is lacking. So in 2004, President Mogae, after the elections, phoned me and said, I want you to come over to Parliament and do what you said we are not doing. I decided, well, this is a honeymoon, right? This is literally a president saying, I need you to come over and help me. I said, okay, I'm going to really take care of this honeymoon phase. I said to him, I'll come, but you need to give me 15% of the budget. Remember, African governments at that time signed the Maputo Declaration, where they Abuja, where they said they would put 15% of the budget towards health. So I said, only if you give me 15. And he gave me that long rope to hang myself. He said, I'm giving you 22. It was like, okay. So I went in and went in as a Minister of Health, the first health professional to be a Minister of Health in the country. So when you are like that, there are quite a lot of expectations. Everybody was happy, including the medical doctors, but happy because at long last we have one of us. She is going to increase our salaries. They look at it the other way. So the very first time during that honeymoon phase, I had to explain to all the health professionals that, you are civil servants like everybody else. What I'm going to do is to make sure that you work in an environment where you'll be able to give optimum care. So I improved the hospitals. I made sure that there was equipment. Literally everything to make that environment. But I said, but in terms of salaries, forget it, because you are civil servants like anybody. I can hurry and make sure that in Parliament I talk about you get certain allowances. But really, let's look at the whole structure. But they were okay, and I really did get support. But the only thing that I did that I didn't have was being a female in a predominantly male environment. Meaning, being what? Parliament is not easy. There were, at that time, about 6 of us who were females in a parliament of 62 people. The great part was all of us were activists, except one. And, we said, no, it's not her taking. It's fine. As long as she's not opposing us, we're fine. So we came about, and we had to be really strategic in engaging sometimes in issues with male parliamentarians to make sure that they get our view, and really that power of influencing, getting putting the knowledge forth. So one of the things that we did was the abolition of marital power. And we agitated, went to the president, and I got evidence from the nurses, mental health nurses, who were saying a lot of the women come in with acute reaction to stress. Why? Because sometimes a woman, because of marital power, it says, as long as you are not married, you are fine. You are an individual, you can own anything, you have your property and all. But once you put on one of these, you become a minor, and your husband controls the property. We got that from England. And at that time, I don't think the British were using it. So, we inherited a lot of things from England that we kept sacred, and they got rid of them, but we thought, no, we're going to keep them. They're very good. So this was one of them. So it meant then your husband could actually literally sell your property without, any discussion and all that. And a lot of women found themselves in that situation. Not too many, but many enough, one too many. So we showed the president just how important it was to do that. And he had already seen some cases that had actually gone to State House, women who had been rendered without property. And of course, that's also a predisposition to HIV. Suddenly, you are economically dependent, independent. Now you are dependent. And when you are that dependent, you are not going to be able to negotiate safer sex, let alone refuse unsafe sex. So that it was really, and I had to show the president from that viewpoint. So he called our parliament, including the opposition, and said to them, gave them what he's actually experienced in the country. And he said, I don't care how you are going to debate this one. We have now the bill. I don't know how you're going to debate it, but whatever way you are going to debate it, the outcome should be the abolition of this marital power. Because this is men. You are saying they should give their rights, even in their own homes. It wasn't an easy one. So, the week we were debating, the men were coming into Parliament holding Bibles. Suddenly, everybody became a Christian. They're holding these Bibles and they stand up. Mr. Speaker, I stand to support this bill, but I want to tell you that it's against God's rule. I want to quote Genesis. And they were quoting all sorts of things. But then when you said to them, one of them, I said, Genesis chapter 1, verse 27. He says, there's another one. Okay. And he made them equally. No, Mr. Speaker, I've been misled. This is not what I wanted. So anyway. So it was just to show them that, listen, the Bible has its own verses and others that contradict. So anyway, but what happened was it was passed. So now women, can inherit property, can inherit land. They have, even their personal rights. Because even before, when you wanted to have a tubal ligation, you were told that, suppose you are not married and you had, let's say, 3 children, and you said, okay, I've had enough and I want to a tubal ligation. The nurses and the doctors were the ones telling you, yeah, but you know what? The men that you may eventually marry may want children. They were protecting the rights of somebody that you didn't even know. So, that was really a good one. And then, of course, the domestic violence bill, this one was not too bad in the sense that Botswana are really peaceful people, but they were seeing that in communities, especially in the cities, there was domestic violence. So we needed that kind of bill. But to ensure also that it's really integrated at community level, so we made sure that the members of parliament really did it. But the most important one then was HIV/AIDS. I then used my knowledge together with working with civil society, because now I had the backing of civil society and the professionals, nurses and doctors, to really do something about HIV. So, we came up with a very comprehensive program that is still the best in Africa. Because Botswana was the most affected. I mean, we are 2 million people, and as our president said, we faced extinction because of HIV. So, but we had free access, and for PMTCT and all that, and we were able to reduce the rate of mother-to-child transmission from 25% in 2002 to 4%. When I left, it was 4%. Even in 4 years, we made it 4%. Now it's less than 2%, which is actually, a great one. Yeah. At least, women are assured of that immortality. And we also reduce maternal mortality due to HIV. And ARV program, our uptake right now is almost 100%. So it's great because as a regional director, I'm in charge of 21 countries. Now you need that credibility. So when I go into a country, let's say I'm going to Uganda, and people know that I'm coming, the first thing the president says is, do we have enough ARVs? Are there any shortages? And okay, no, tell Sheila she can come. Yeah. If I had not done such good work, nobody would really be caring. But now, I usually say, I have the greatest job in the world. I talk about sex to ministers, to presidents. And, I rubble race. Right now, we're talking human rights, the rise of, key populations. Key populations are what? Men who have sex with men, sex workers, drug users. So I get there and I usually say, as Your Excellency, as an African woman, I have children. Some are sex workers. Some are men who have sex with men. Others are heterosexual. They need the love, the care, and the dignity, all of them. And that's all I'm asking, that they should have access to services. And coming from an African woman is usually a lot more credible than if it was some American women saying so. Or because it's like, they're putting Western thought into it. They're coming with their Western ideas. Now this time, the ideas are coming through yours truly, a woman, a mother. So it becomes a little bit more palatable. But people are still very holier than thou art. But, I usually say, I'm a Catholic. Very holy, holier than thou. But a Catholic with a conscience. A Catholic who practices evidence-based Catholicism. So as UNAIDS Regional Director, my mandate is really to MDG 6, which said you must halt by 2015, I mean, it means this year, halt and reverse the spread of HIV. So we will be reviewing MDG 6 on the 8th of June. But it's really great that we have a story, a good story to tell. We have people living with HIV, 35 million. But they don't matter in the sense that we are talking now prevalence. Prevalence has to increase in the sense that even if you had 2 infections, every week, prevalence would increase. Why? Because of survival. People are surviving, and that's what we want. We want people to be able to live. And now, we want also those people to be on ARVs, because we found that ARVs not only save lives, but they also prevent HIV. That somebody who's infected, who is on ARVs, who is virally suppressed, is not likely to transmit to another person. So we are encouraging countries, therefore, to really test and treat. Of course, WHO still has this mandate of CD4 cell counts, but in countries in my region, for example, that have really reached, my region spreads from Eritrea all the way down to South Africa, including the Indian Ocean Islands. So those are the countries that are most affected. But so those are adults and children living with HIV. For you, as you can see, Asia and the Pacific, not too bad, but the brunt is in sub-Saharan Africa. Don't ask me why. It has a myriad of, reasons, but we'll talk, during tea time. But these are the 15 countries that make up the epidemic in the whole world. Now, most of these are mine, except Nigeria there, where you have India, my country, India. Yesterday, we were all Indians. And except, of course, Russia, United States, Brazil, and then, all that. So, but the brunt of the epidemic is in South Africa. That's why, in a way, I'm glad that I'm from Botswana, but the regional office is in South Africa. I've been able to work with the president and the minister to the point where now 3 million South Africans are on ARVs, out of 6 million. So that's like half. We still have a long way to go. But 3 million, they've been able to push that within a very short space of time, because when I was minister with Dr. Manto Shabalala, whose president was Thabo Mbeki, who had strange ideas on HIV. So nothing moved in that country. And as a result, that's how come the infection rose to the point where when Zuma came in, he was able to really do quite a lot. People usually say to me, well, Sheila, how are you able to work with Zuma, with his many wives? And I say to them, I worked with Thabo Mbeki, who was very faithful to one wife. He didn't do jack for his country. I'm with Zuma, with his many wives, and he's doing a lot for his country. I'd rather have him than the other. So, and he's in the right direction. He's really great. Yeah. So, but as I said, in the world, globally, we still have only half the people who know their HIV status are on ARVs. There is the other half that doesn't know their HIV status. Hence, we are really trying to get countries to test. One of the innovative things that we had to do in my region was to say to countries, you can actually get into the Guinness Book of World Records. And yes, we had one testing day, which was my birthday, which was really nice, 29th of November. All the countries put up testing. And the Guinness Book of World Records for single testing was won by Ethiopia. For multiple testing, Botswana, Lesotho, Tanzania, and South Africa. So we have the Guinness, we hold in the Guinness Book of World Records. But we also made sure that those people who are tested are also referred. And those who test negative are also referred so that they stay negative. Because that's really essentially that. So, but really now our philosophy is that we want by the year 2020 that 90% of the people should know their status throughout the world, including you. 90% should be on treatment and virally suppressed. That is the only way we can get to 0 by 2030, because the aim is to eliminate HIV as a public health threat by the year 2030. And I think we'll get there. With right now, our importance is really location, and population. If you look at those dots, the big blue one, we call them the people left behind. The blue dot is young women. The light blue one are sex workers. You don't exist, so we don't have anything, so you are lucky, stay lucky. But as you can see, you see where, in the various continents, where you need to focus in. America's men who have sex with men, Britain, people who inject drugs. So we really have that. We need to focus without being very judgmental, because in the ultimate, if you don't get to these people, you will not get to zero. And that's really the thing that we sell to our African, presidents. We say, look, sex workers are here. They were there in the Bible. They will always be there. The main thing is, let's make sure that they are not infected. And when I really want to shock a president, I say to him, listen, my children and yours usually first learn how to have sex through a sex worker. Now, would you like them to go to somebody who is infected and they can't even use a condom? And they look at me like, yeah, because they don't know. It's a great possibility. So we also have, as I said, mother-to-child transmission. These are the gaps. So there are quite a few countries where there's still a gap in preventing mother-to-child transmission. There are some that have really moved ahead. So the idea is really advocacy to make sure that women are put on treatment. But as we say, the best way to prevent mother-to-child transmission is to prevent the woman from being infected in the first place. So we try by all means to ensure that we work with everybody, including men and boys. Much as I focus on women, I know men and boys can be very much left behind. If you look at globally, ART coverage, men are the last to be covered. Why? Because throughout the world, even in Australia, being sick is not masculine. So they are the last to go for any testing, the last to go for any checkup. So we're trying to really get them so that we are engaging men and boys for their own health, but also because we know they influence the health of families. So these are the deaths globally, men and women. Look at the men one. It's almost like plateauing, right? But for women, because they are engaged in getting ARV treatment, is going down. We want it to go down further, but both curves should really be going down. So we are engaging a lot of women's organizations and really ensuring that is that. So, but adolescents and young people living with HIV, this one is relevant even to Australia, that we have successful programs, but the young adults are not protected. We take for granted that everybody should be knowing. We forget that HIV was taught. People didn't know. Even medical people, health people, nurses didn't know. It was not in the curriculum. Now it is. But then we take, everybody should be knowing. No, they don't. And they're entering that sexual debut without knowing. So sexual and reproductive commodities are not available in school settings. So what we did in Eastern and Southern Africa was to get ministers of health and ministers of education together. Now, this was one of my really great adventures, because I was taking phones and going, you are coming to Durban, right? To the various ministers. And I made sure that all 21 of them are there. Ministers of education and ministers of health. And they came and signed, adopted a comprehensive sexuality education to say we are going to work together at country level and ensure that we really save the lives of our children. So it's done. Some countries have run away with it. Others are still there, still grappling. But the great part is, in no country are we facing any parental resistance, because the parents have seen people dying. And therefore, they were not having the capacity to talk to their children. Now, if a teacher can do it, all the better. So right now, of course, even the young people are saying, but we want our parents also involved. That's fine. Comprehensive sexuality education includes that. It also includes assertiveness, gender equality, human rights, all the things that we make up for really good citizens, both men and women. And I think we're getting there. So But we also have evidence now that for adolescent girls, because people usually say, what do you think it will take to end AIDS? I say, in the absence of an HIV vaccine, the only vaccine we have right now is to keep girls in school. Make sure they're educated, they can get employed and all that. And really, that's basically that. Providing information and services, enabling environment, and social support. Some countries have even started cash transfers, where if girls are married off, sometimes it's because the family needs money. Now, if you can give that child $10 a month, it actually makes sure that those parents will keep that child in school. So there's evidence, the World Bank is working with that, with us on that. And children in some countries are being kept in school, especially countries like Malawi, Ethiopia, where children are still being married off. That's a predisposer. That's also gender-based violence. But, we've seen that. So we're also working with partnerships. We have organizations. The Organization of First Ladies Against HIV is something that we formed because we figured, hey, if you are able to whisper to the president in his pillow, I think you are the most powerful person. Therefore, we need you to advocate for us. Champions for an HIV-free generation are former presidents who did a lot on HIV. So President Mogai, my own president, because he was really the forefront leader, he is chairing other presidents to teach or to talk to the ones who are incumbent, to say, this is where we failed, and we think this is how we can take it. So also the high-level task force, but also we have a Pan-African Positive Women's Coalition, women living with HIV, who are really able to articulate and say, we want to end HIV in our communities. So lessons learned is really, we've had significant progress. Is now 80% PMTCT, and we are on track in Eastern and Southern Africa. ISA is Eastern and Southern Africa. We are on track to eliminate mother-to-child transmission. Even really in Sub-Saharan Africa, we will eliminate. But new infections still high, and we need to make sure that no one is left behind, especially key populations. And that advocacy, that's where I go from being brave to bold, because it's not easy to go to a president and start talking about men who have sex with men. The African ones is almost like, that is so un-African. I don't know if you ever saw this series. We took a series where we put some presidents in, and we asked, is homosexuality un-African? And that was the most interesting debate ever. But the end result was, it is as African as they get. We just used to ignore them, but now HIV is saying, you want to get to zero? They have rights. They need access to services. You can't ignore them. I usually just tell them, it's not like I want marriage. That's a different story. I want them to have rights to access services. That's all. The rest, they'll be able to do that themselves. So that's what I'm really doing, yes, regional director, strengthening social protection and human rights, but also working with civil society, because in the ultimate, communities do matter. Whether you are a nurse or, a doctor, or what happens in the community is really what determines what is there. So right now we're working on the Sustainable Development Goals. Remember, the post-2015, they're going to be negotiated in September. But they include all those. Environment, people are now on environment. The world has moved on away from HIV. So we are saying, us in Africa are saying, no, let's not move too far away. It's still here, and we don't want that resuscitation of the deaths that we used to have. So we are going to have it integrated into inclusive social development, as well as the human rights, gender equality and sustainability. Now, if you look at the goals, there are 17. They're going to be negotiated. I think your ministers will be, your ministers will be there. But MDGs were only 8, right? Now, a lot of countries did not meet, were not able to meet them. Now we have 17 goals, and with 160 targets. How anybody thinks they're going to be, met is really something else. But at least for me, there are 3 that matter. 3A, that by 2030 we'll have ended HIV tuberculosis and malaria. And of course, research on vaccines and health financing, especially the development and retention of the workforce, especially the nursing workforce. Remember, there is still a shortage throughout the world of 8 million healthcare workers. We'll never reach that shortage if we are not training and really making sure that we retain our people. So it's really that. But overall lessons learned, and that's my concluding one, is simply that leadership is a journey. It's a journey that requires skills and competencies, and it requires us to be brave to bold. But we have to travel it. It's as simple as that. And knowledge is power. So ICN has actually mandated nurses to say, you need to involve other people, you need to work with stakeholders, get that evidence, and make sure that you contribute to knowledge. So that one is an International Council of Nursing mandate, and I'm hoping that those of you who are going to Korea will be right there in June and sharing that knowledge. But the world needs research, nurses who are research-oriented, who can produce evidence and really ensure that that evidence produces policy and all that. But the most important one for me is that we need nurses in political office. That's brave to bold. Who can ensure good governance and really legislation that is more inclusive and that can really address our social issues. Now let me tell you something. Most of the time we look at men and we as women, we think, in a political office. But here is something. Adam, the very first guy that God made, when he was in that Garden of Eden, and after he ate whatever it is he ate, with Eve, God came and asked him, Adam, where are you and what did you do? And guess what he said? He didn't say, oh, we were tempted with. He said, the woman that you gave me made me do it. Men never spoke for us then, and they never will. The very first men didn't speak for us. So we need to be able to get there as women and speak for ourselves. It's as simple as that. And lastly, that's why I needed to see more young people here, because as nurse leaders, as APNA, we need to inspire, to motivate, and ensure that we do have future nurse leaders with us. So thank you very much. Yeah.
Thank you.